I am Annika Izagiri. I'm Communications Director with the Committee to Protect Healthcare. Thank you for joining us today. As you know, members of the U.S. House are back in their districts this week for recess, and physicians are calling on them to use this time to answer for their support for massive cuts to Medicaid. The physicians joining us today will share how these cuts could impact their patients and communities, and why their representatives should cease further support for cuts. Before we begin, I'd like to note that the physicians speaking today are doing so as individuals and with the Committee to Protect Healthcare, not necessarily on behalf of any employers. So we respectfully ask that you please only refer to them in any of your coverage as they introduce themselves on this call. And we ask that you please do not include employment information unless they expressly share that. So thank you in advance for being respectful of that. I do also want to note that Dr. Johns was supposed to join us today as well. She is dealing with a critical patient situation, so she may be able to log on later. But for now, we have Dr. Shapiro and Dr. Shelton with us. And so without further ado, I will turn it over to our first speaker, Dr. Shapiro.
Hi, I'm Dr. Eve Shapiro. I'm a pediatrician in Tucson, and I'm here and joined by my colleague because we're deeply alarmed by what is happening in healthcare in Arizona. Right now, over 2.2 million Arizonans rely on Medicaid, known as Access here in our state, to afford the healthcare they need. That's 31% of our state population. That includes 191,000 seniors, 752,000 children, and 173,000 people with disabilities. And as a pediatrician, I know that almost half of babies born in our state are covered by Access. And yet, Republicans in Congress, including my own representative, Juan Ciscomani, are actively working to cut Medicaid and take that care away. In Representative Ciscomani's district alone, 171,293 people depend on Medicaid. If these cuts go through, 54,774 children and 27,000 seniors will be left without access to health care. And these are mainly very poor seniors who have Medicare and Medicaid coverage, dually eligible. Recently, Congressman Ciscomani acknowledged the dangers of gutting Medicaid. He specifically warned that cutting Medicaid would have serious consequences, particularly for rural and Hispanic communities, where hospitals and nursing homes are already struggling to stay open. And yet, he turned around and voted for the very budget resolution that paves the way for $880 billion in Medicaid cuts. Representative Ciscomani himself cautioned that Hispanic Americans would be closely watching their representatives to see if they uphold their values. Well, Congressman, we were watching, and you failed that test. Instead of protecting the health of his constituents, Representative Ciscomani voted to pave the way to cut the very programs that keep families, seniors, and children healthy. The only values he honored were those of the ultra-wealthy who would benefit from a tax cut. Congressman Ciscomani knows that there is no way to slash Medicaid funding by billions of dollars without ripping health care away from our most vulnerable neighbors. Families in Arizona will lose their coverage, hospitals will face financial disaster, and rural communities will suffer insurmountably. And for what? To pay for massive tax cuts for billionaires and big corporations. This is a direct attack on our patients and families and our state. Representative Ciscomani is back in the district right now while Congress is in recess, and he owes the constituents an answer. Why is he choosing to take health care away from children, seniors, and people with disabilities in Arizona? Along with several of my physician colleagues, I met with Representative Ciscomani's staff to share our grave concerns about how these indiscriminate cuts to Medicaid wouldn't do anything except hurt the most vulnerable Arizonans. As constituents, we deserve to know where the representative really stands. Congressman, will you stand with your constituents or will you continue to stand with the ultra wealthy at your district's expense? Because we are watching and we will remember. Now I'd like to turn it over to Dr. Shelton to share how these cuts will impact patients in Arizona's first congressional district. Thank you.
Thank you, Dr. Shapiro. My name is Dr. Shelton, and I'm a family medicine physician in Phoenix, Arizona, where I care for patients of all medical backgrounds, many of whom rely on Medicaid for their health care. I'm appalled because my own representative, David Schweikert, is supporting a plan that will strip healthcare away from families, children, and seniors, some of our most valuable neighbors, in Arizona's first congressional district. In our district alone, 127,526 people are at risk of losing their health care, including 44,987 children and 17,000 seniors. This is not just a statistic. These are real people, real families, and real children who will be left behind with no way to afford checkups, asthma treatments, or even vaccines if these cuts go through. Representative Schweikert claims that the budget resolution he voted for doesn't have to cut into Medicaid, that we can find savings elsewhere by modernizing technology and eliminating outdated systems like fax machines. But you can't fix a $2 trillion giveaway to the rich by upgrading office software. The reality is that no matter how many fax machines get replaced, the budget still rips healthcare away from Arizona families. That's not modernization. It's cruelty disguised as efficiency. I have cared for grandparents who went from being medically fragile and multiple hospitalizations to living independently, all because they could have access to a continuous glucose monitor that alerted them to dangerous blood sugar levels before they became emergencies. That's real modernization that saves lives, but that's not what Representative Schweikert and his colleagues are proposing. Instead, they are pushing rushed, indiscriminate Medicaid cuts that would strip away access to life-saving tools like continuous glucose monitors for hundreds of thousands of Arizonans. The reality is, no amount of bureaucratic tinkering can change the fact that cuts Congressman Schweikert voted for will take away healthcare from hundreds of families, seniors, and children across Arizona. Like Representative Ciscomani, Congressman Schweikert is back in Arizona while Congress is out on recess, and he should be answering to the families who will be directly harmed by these cuts. The people of Arizona deserve better. We must stop this attack on Medicaid before people with and without Medicare are seriously hurt. Thank you.
Thank you, Dr. Shelton and Dr. Shapiro. Dr. Jones has not been able to join yet. If she's able to join later, we will invite her to share her remarks too. But for now, we will open it up for questions. If anyone from the media has a question for Dr. Shapiro or Dr. Shelton or both, you can go ahead and ask that now. You can do so by typing it in the chat box or in the Q&A. Or if you prefer, you can raise your hand and I can unmute you so you can ask your question verbally. So we will allow a few moments for folks to be able to gather those questions. I haven't chatted to me. I will read out loud. What would you say directly to your representatives if they were on this call today? And that's for either or both of you.
I can start. I think I would just say that the remarks that I just gave, that I really want him to try to explain how he could say he supports Medicaid and yet vote for a process that's going to eliminate $880 billion from the healthcare budget, which is going to come out of that Medicaid funding. I just want him to explain how those are mutually exclusive. How does he justify that? And to just get a better understanding of where he's coming from and does he really see the damage that his decision could make.
Thank you. Thanks for the question. Another one, can you share any, excuse me, can you share any additional examples of patients whose lives would be drastically impacted if these Medicaid cuts go through? Again, that's fine. There we go.
Yeah, I can go ahead and take that one. As a family medicine physician, I take care of patients of all age groups. Children would not be able to afford the medications that help them stay in school. Seniors would not be able to afford medications or treatments that help them live independently. And ultimately, these cuts in Medicaid would mean that these patients go untreated until their medical conditions become medical emergencies. This would further strain our hospital system. So when people without Medicaid also get sick, the resources in hospitals are not infinite. And ultimately, this cutting Medicaid will affect everybody, whether they have Medicaid or not. It will affect every patient.
And I just wanted to add to what Dr. Shelton said, that the whole point of having insurance is to treat problems before they become major. And if you wait until something is an emergency, then the cost is so much greater. So by cutting access to preventive and early treatment care, you're increasing the cost to the system as a whole. So it makes absolutely no fiscal sense as opposed to ethical sense.
Thank you. We have a question in the Q&A from Stephanie. Do you think patients covered by Medicaid realize the threats these proposed cuts pose? Or does there need to be more awareness among people covered by AHCCCS/Medicaid?
I can take that again. I can only really speak to what I've seen in my own practice, but these patients who rely on access, they do have a lot of stressors in their lives in addition to healthcare. And they are scared that they are going to lose this one support system that is helping them keep this part of their lives under control. I don't think more exposure or more education about a topic is ever a bad thing. But from what I have seen, they are aware and they are concerned.
And I would agree with that in my experience as well. And I think that's why there's been a big outpouring of opposition to these Medicaid cuts. I know there have been many demonstrations at Representative Ciscomani's office highlighting these very concerns.
Thanks for the question, Stephanie. There's a couple questions from John also in the Q&A. The first one for either of you or both is, how would these cuts impact the doctor and nurse shortage?
I could start with that. So if you have fewer patients with healthcare coverage, it makes it harder to support the healthcare workforce as well. And there have been projections of how this would affect healthcare workforce in hospitals and physician offices, community health centers, which are also threatened with cuts. And so it obviously make those workforce issues much more significant. And we already have a huge shortage, particularly in primary care in our state, and it will only exacerbate that.
I just wanted to say I agree with Dr. Shapiro. And what the downstream effects of this could be is also that as healthcare workers become more thinly spread out, more overworked and strained, especially in hospitals where they're taking care of emergent healthcare situations, it will lead to burnout and it will lead to people leaving medicine. This is already something that we've seen in the aftermath of COVID, where people have left medical professions in droves. Nurses have switched careers or go on out of medicine completely because of the strain that they were put under during the COVID pandemic. And should something strain the hospital system like that again, it could worsen the shortage yet again.
And let me just add one other thing. Um, when Dr. Shelton talks about burnout, I also like to think of it as a moral injury. So as a physician, when you are seeing patients and you cannot provide the care that you know they need and deserve, that puts you in a very difficult position because you're not doing what your professional ethic tells you to do. And that's another reason that contributes to physicians and other healthcare workers feeling that it's just becoming overwhelming, too difficult.
Great question. Another question from John, for either or both of you. Have you seen any of the waste slash fraud slash abuse of Medicaid funds that are the ostensible reasons for the cuts?
Again, I can only speak to what I've seen and who I've cared for personally, but no. The people I see who come in with access are trying to get preventative healthcare treatments that everybody should be getting at least once a year. And they are getting the intended medications for conditions that they have been diagnosed with. Personally, no, I have not seen this fraud that the representatives have mentioned.
And I would agree with that. And I also wanted to say that there's some um, idea among many Republican representatives that somehow healthy people are ripping off the system by claiming to be Medicaid eligible when they're not. And when that's been looked into, it's found to be just a fallacy. There's a tiny minority of people who are in any position to work and earn enough where they would not be eligible for Medicaid. And the states that have tried to put work requirements on people have found that trying to find those few patients is so intensively expensive administratively that it was not worth the effort. And so to go to look for that as a solution to this problem it's never going to be a solution because there is no there.
Thank you both, and thanks for those questions, John. I am not seeing any other questions, so we'll go ahead and wrap up today's call. I want to thank all of the media who took time today to join. I know it's a busy time, so thank you for being here, and thank you so much, Dr. Shapiro and Dr. Shelton, for your time and for lending your voices on behalf of your patients as these potential cuts are in the works. We appreciate you being here. All right, thanks everyone. Have a good afternoon.
Bye-bye.
Thank you.